Well, with a shuffle in priorities happening at the White House, Austin Public Health says it is closely monitoring resources it might lose.
Especially when it comes to tracking infectious diseases like flu and COVID-19.
If funding were to go away, there may be some things that also go away, like the federal wastewater surveillance system. We are concerned and we're monitoring closely whether we'll lose any data, access to any data sources.
And at a time when you may have lots of sick friends and coworkers, as is common this time of year, APH says they're still working behind the scenes to monitor those conditions and report any concerning trends. KXAN's Grace Reader breaks down what's changed since the pandemic, what's the same, and how you can monitor yourself.
You're hearing it from health agencies, and you might be feeling it in your circles. It's the season for being sick.
Fortunately, I think we're at the peak of our flu season.
During the COVID-19 pandemic, Austin Public Health had a dashboard and gave regular briefings, so it may have been easier to track what was going around and how bad. What about now? Austin Public Health says they're still doing much of the same tracking behind the scenes.
We engage clinical providers or physicians out in the community, those that run big practices, and when they see patients that come in who have influenza-like illness, we ask them to take samples for flu or RSV or COVID, and we send that off to the lab.
Austin Public Health also still tracks hospitalizations and deaths related to those illnesses.
And then finally, since COVID, one tool that we've adopted that we work with the Centers for Disease Control and the state on is doing wastewater surveillance for those conditions.
But how are you supposed to know? While the COVID-19 dashboard has been retired, Austin Public Health does have its flu trends page, which looks like this. It doesn't capture total number of cases, but looks at overall trends for flu-like illnesses.
There's a link for a weekly report that we update every week, and it will give you a more detailed view and analysis of what's circulating in the community.
Grace Reader, KXAN News.
And the state of Texas also has a Texas Respiratory Illness Dashboard, which is updated weekly. You can find information on COVID-19, the flu, and RSV there, including emergency room visits, hospitalizations, and deaths.
And going in depth during the pandemic, COVID-19 was labeled a reportable disease condition. So that required all providers like nurses, hospitals, and healthcare providers to report COVID-19 outbreaks or positive tests to health departments. But that designation for COVID-19 has gone away, and those groups are no longer required by law to report cases to Austin Public Health. During the pandemic, we also reported heavily on the COVID-19 modeling consortium at the University of Texas. That has since turned into what's called EpiEngage, a CDC center based at UT that is working on outbreak forecasting tools for the future. You can hear more from the team behind that effort tomorrow on KXAN News at 4 p.m.